My name is Tiffany and I suffer from chronic sinusitis. I am a nurse at a large ENT office. With my type of sinusitis, I did have some drainage, but most of my symptoms were facial pressure and pain, a lot of discomfort, a lot of yucky drainage. My stress reliever is working out, and when I was having my sinus problems, it was affecting my hobbies that were my happy place. It affected my daily routine with my family and my exercise. When I got off work, I just wanted to come home and go to bed. I didn't want to go and play with my children and spend time with my family because I just felt so bad. I started having headaches, and I just thought that they were maybe a sinus infection because I had just recently had a cold. Started using over-the-counter medicines and doing some sinus rinsing, and I started having some nasal congestion and discharge, so I thought it was time to go to the doctor.
Tiffany works in my office, and I was seeing her on a relatively frequent basis, coming to work not feeling so well. So we chose to investigate and found that she was dealing with issues of chronic sinusitis. To begin with, we started with sinus rinses for Tiffany, and we followed that with topical steroids and antibiotics. We sat down and looked at the x-rays that showed significant cloudiness of multiple sinuses, despite the best efforts of us both. So we finally sought consultation for surgery.
Dr. Cawthon had explained that he was going to use an image guidance machine to go inside of my sinus, use a balloon to dilate it, and then insert a Propel stent to help keep it open and improve the outcome.
The benefits of Propel to the patient are twofold. Number one, the device has a spring action that keeps tissues open without folding onto themselves and scarring closed. And number two, the device is embedded with a steroid, which allows for release very slowly of that steroid into the sinus tissues to which it's touching and surrounding. And in doing so, keeps scarring from being manifested in a closure of an opening and makes for a healthier, happier sinus.
My sinus surgery with Propel went very well. I was very surprised at how quick the pain was gone. I was also surprised at how well I felt.
Tiffany is a true trooper. After her surgery, I called her to check on her. She was already feeling better. I saw her at least twice at 2-week intervals just to check everything with her nose and sinus surgery, and she was recuperating wonderfully well, back to work, feeling better than she'd felt in months.
I noticed the difference after getting my Propel stent when I went back to my HIIT class. I was able to get back in a routine of just working out without pain or pressure. I felt really good because I was able just to be able to do the things that I absolutely love. I feel amazing. If you are having sinus problems and you are a candidate for a sinus procedure, I recommend that you ask your doctor if Propel stents are the right option for you.